Most male patients with gynecomastia have what we refer to as mixed gynecomastia. We say mixed because it involves both excess of fat and excess of breast tissue. The amount of breast tissue excess can be variable, as can the amount of fatty tissue excess. But because there are two different issues going on, a multimodality treatment is important to effect an aesthetically ideal cosmetic improvement. The three-step approach to gynecomastia reduction involves liposuction, followed by fibrous tissue removal, followed by direct excision of a small amount of fibrous tissue on the backside of the areola. First, liposuction is performed using metal cannulas, some of which are flared and some of which are not flared. The flared cannulas are used initially with the aspirator or suction device turned off. The flared cannulas are very effective at breaking up fatty tissue prior to removal by aspiration or suction. Once the excess fatty tissue is adequately mobilized, a non-flared cannula is put on the electric handpiece that pistons the end of the cannula back and forth a few millimeters to enhance the efficiency of fat removal. Fat is removed using the non-flared cannula, and the patient is then evaluated in the upright sitting position under general anesthesia to ensure that the fat removal is smooth and aesthetically ideal. Once fat reduction has been accomplished, the second stage is removal of fibrous tissue, and this is accomplished using an arthroscopy shaver. An arthroscopy shaver is a hollow tube that has a device on the interior that chews up fibrous tissue that cannot be removed using a liposuction cannula. So this device is somewhat more aggressive than a liposuction cannula. The shaver is used to remove the firm fibrous breast tissue directly behind the areola. Once this is completed, the patient is again brought into upright sitting position, and the reduction effect is assessed to make sure that it is smooth and symmetrical. Lastly, at the end of the procedure, through small incisions made on either side of the areola, a very small amount of breast tissue is removed from the posterior surface of the areola to eliminate that little bit of conical shape or excess projection of the areola itself. This stepwise excision of breast tissue and excess fatty tissue is the best means to accomplish a smooth and aesthetically ideal gynecomastia reduction.